my audience. Okay, good afternoon, everybody. So I want to start by asking all of you guys something. So, um, when you guys hear the word mental health, what comes to your mind? Maybe a lot of people are gonna think about anxiety, stress, or even depression, right? And but according to the Center of Disease Control and Prevention in 2025, according, sorry, according to the Center for Disease Control and Prevention in 2025, around 40% of high school students have reported feeling really sad, really hopeless, and during the past year, sorry, that's almost like all of the high school students, right? And I think that's honestly a pretty like really shocking number. And I feel like mental health is something that affects all of the students, and but it's not always talked about until it becomes a really big problem. And since students spend most of their days at school, I think school should be part of the solution too, right? And to learn more about this topic, I looked at information from the CDC from 2025, the California Department of Education from 2025, and also the American Academy of Pediatrics from 2021, and I will be using other um, reliable sources for this. Today, I want to persuade that California should expand mental health services in public schools so students can get the support they really need before the mental health becomes a really big problem. First, I will be talking about the mental health challenges many students are facing today and why this is becoming such an important issue. So, to start, mental health challenges are becoming more common and among students. So, according to the Center for Disease Control and Prevention in 2025, one, 1 in 5 students have diagnosed with mental health, emotional, and also behavioral health condition, and around 40% of high school students um, have reported feeling sad or have been feeling really sad or really hopeless the past year. But these numbers shows that mental health is affecting a lot of students, which is why schools need to really support them. So they really had to support them and also feel like mental health can be affected and students do and how can affect students do in school. So according to the study published in International Journal Medicine Psychiatric Research in 2022, students with poor mental health were more likely to have more academic performance over the time where students are dealing with anxiety, depression, or all the mental health challenges. So um, it can be really hard for them to focus in class, um, also to complete homework, or also to stay motivated, and also so now that we talked about some of the challenges students are facing, let's look at why many students still struggle and to provide enough mental health support. So first, many students sleepy don't have enough mental health problems. Have mental health professionals, sorry, but according to the National Association of School Psychology in 2025, school psychologists provide important mental health and behavioral health services, but many schools still don't have enough staff to support every student who needs help. Because of this, student may have um, to wait longer or have or may not have support at all. So making it harder to address mental health concerns before this becomes really serious. Um, according to another reason, sorry, is that many students still don't receive professional mental health care. So according to the American Academic of Pediatrics in 2021, only about 20% of the children with mental health conditions um, receive care from specialized mental health providers. That means that many students who need help still not getting it. And if school had more mental health services um, available, more students could get the support that they really much need in school. Um, so finally, we're gonna be talking about how California can help students by expanding mental health services in public schools. For example, first, I'm expanding mental health services in schools. Um, can can make it easier for students to get help when they really need it. According to the American Academic of Pediatrics in 2021, students are more likely to seek mental health support with these services are available at school. Um, since students spend most of their day at campus, I'm having counselors, mental health professionals that can make really big difference having them in there. By expanding these services, schools can help students um, before the mental health challenges become more serious. So these helps are gonna help them really well. Um, also, um, before I finish, I want to talk a little bit more about one argument that some people might have still. Like, some people may say that expanding mental health services in school would cost a lot of money, and the school should be focused more on the academic side instead about giving money to having more mental health at schools, right? And I understand the struggle. Um, I understand, that sorry, by adding more mental health services would cost money, but however, I think helping students with their mental health can also improve attendance. But to conclude, at the beginning, at the beginning of my speech, I shared that about 40% of high school students reporting feeling sad, hopeless, and during the past year. Today, I talk about the problem